Hello everyone, welcome back to my YouTube channel Dr. Barkis Ophthalmology Tutorials. Today we will discuss about amniotic membrane transplantation. So let's discuss this topic of amniotic membrane transplantation under the headings of Introduction or the History of Amniotic Membrane Transplantation. What is the source of amniotic membrane? What is the histology of the amniotic membrane? What are the functions of amniotic membrane and how do you harvest this amniotic membrane? And finally, what are the uses of amniotic membrane? Without much delay, let's begin our video on amniotic membrane transplantation. If you are not subscribed to my channel, please do consider subscribing to my channel. So now we will see about the history of amniotic membrane transplantation. So use of amniotic membrane in the medical field started way back in 1910, where Davis used the amniotic membrane as a first surgical material. Then in 1935, Brundy and Burgel used it for the vaginoplasty. And then in 1940, Chavo and associates used it for the various purposes, like for the treatment of the burns, as a dressing for the wound, and in case of chronic leg ulcers, as a skin graft, in case of amphocyl repair, as well as in abdomen, pelvic, and even in the ENT surgeries. Then in 1946, D. Roth first used the amniotic membrane in the field of ophthalmology in the treatment of pterygium surgery, where the base sclera was covered by the amniotic membrane. Then later in the same year, Lavery and the Sorsby also used the amniotic membrane for the treatment of the chemical wounds of the ocular surface. Since then, the amniotic membrane has been used very widely in the treatment of ocular surface disorders. So with this introduction, we will move on to amniotic membrane transplantation in ophthalmology. So without much delay, let's begin our video on amniotic membrane transplantation in ophthalmology. What is the source of amniotic membrane? As you all know, it is from the placenta. Amniotic membrane forms the innermost layer of the placenta, closely fused with the outer membrane, that is the chorion. And how you get the amniotic membrane from the placenta is usually obtained after the cesarean section. Then it undergoes various process and then we can extract this amniotic membrane from the placenta and use it for the ocular surface disorders. So now moving on to the histology of the amniotic membrane. The total thickness of the amniotic membrane is around 0.2 to 0.5 millimeters and it has 5 layers. Okay, so from inside to out, first we have the epithelium, which is single layer cuboidal type of epithelial cells. Then we have the basement membrane, followed by compact layer, and then fibroblast layer, and finally we have the spongy layer. And each layer has its own importance, which is making the amniotic membrane to be the ideal material for the transplantation. Among all this compact layer has few important properties, like it is made up of type 3 collagen, gives the tensile strength or the expansibility to the amniotic membrane, and it also acts against the proteolytic degradation of the amniotic membrane. So why we are using amniotic membrane only for the transplantation? Because the epithelium here can survive for almost 70 days under preservation at minus 80 degrees centigrade. This amniotic membrane is devoid of our nerves or the blood or even the lymphocytes. And the most important thing is it doesn't express HLA, A, B or DR antigen. So it is not immunogenic. Hence it is ideally suited for the transplantation purpose. So what are the functions of this amniotic membrane? It is used extensively because of these two important properties. One is it will promote the epithelialization and the second is it will inhibit the fibrosis. This amniotic membrane has various matrix proteins which will help in epithelial migration, adhesion, differentiation, and also prevents the apoptosis. Thereby it will promote the epithelialization. The second property is the amniotic membrane will produce various types of growth factors like the fibroblast growth factor, hepatocyte growth factor, the transforming growth factor. So all these factors will modulate the differentiation and the proliferation of the conjunctival as well as the corneal epithelial cells. And also this amniotic membrane has very tough basement membrane which will act as a scaffold over which the epithelium can grow. So all these factors will contribute in epithelialization of the surface. How it will inhibit the fibrosis? This is directly by down-regulating the fibroblast receptors itself. The second is the fibroblast will release the chemokines, but this step itself is inhibited by your amniotic membrane. So along with this, it also has antimicrobial property, anti-adhesive property, wound protection, pain reduction, anti-angiogenic and also pro-angiogenic. It has its antimicrobial property because it itself acts as a barrier for the infection. And second is amniotic membrane also has the antimicrobial cytokines which will protect against the infection. Then we have the anti-adhesive property. This anti-adhesive property is because of the production of tissue inhibitor metalloprotein, and mechanically it will have that wound protection activity, and it also reduces the pain because it's covering the open nerve endings. and this anti-angiogenic and the pro-angiogenic. Both are opposite actions, but that depends upon how you place the amniotic membrane. So if you are placing the amniotic membrane with the epithelial side up, then it will act as pro-angiogenic, and if you place the stromal side up, then it will act as anti-angiogenic. So these are the few important properties of the amniotic membrane which will make it an ideal material for the transplantation. So we'll stop at this point. We'll continue with the harvesting of the amniotic membrane and the indications of amniotic membrane in the next video. So hope this video is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos. Thank you so much.